So yes, we can use testosterone on women. It is perfectly safe. We're not doing super high doses. We're trying to get her back to a physiologic range where she feels good again. Hello everyone, I am Dr. Nicole Smith, founder of Antigravity Wellness, coming to you live from inside my infrared sauna. It's not officially mine. No, there's no red light in the sauna. You do not need to have red lights in order to have infrared sauna heat. It's two different things, though sometimes they combine it. So, and I just learned something really cool, really good thing from actually Dr. Carrie's website or blog. And she hosted a podcast with another doctor talking about infrared sauna heat for perimenopausal and menopausal women. And the thought, like, those women who are having hot flashes, do you really want to get into a sauna and like cook yourself? Probably not. But you can still get the benefits of it without having to go to those extreme heats. So sweating is not necessarily the goal, which is also something that's commonly misunderstood. It's kind of like in the gym, like the goal is to be exhausted. It's actually not. But we got trained that way. So you think you have to sweat in order to get the benefits, but that's not necessarily true. That's where the infrared part of it comes in. It's still changing things on the mitochondrial level and things like that. So if you still want to enjoy a sauna, but don't want to cook yourself as hot and think, you don't have to. You don't have to. That's what I'm getting to. Same thing with cold tub. Oh, it's irritating because there's so many people who are like, oh, you have to like get it to 40 degrees or some crazy thing. Like, you know how uncomfortable that is? So the point of the cold therapy is to basically like kind of shock the system there, yes, but not to the point that it is miserable for you. And if it's too extreme for women in particular, and perimenopausal women in particular, it will actually have detrimental effects for your health, not beneficial. Again, we are not small men. We need to stop extrapolating these things from men's perspective and men's studies to women. We are so different hormonally. It's a huge thing. All right, so I digress though. I brought notes today. So I saw a post. I follow a couple groups on menopause, perimenopause, just to kind of like make sure I'm keeping a pulse on what people are saying out there and talking about. What are the concerns? What are the questions? Things that come up. There was a really good post today of true or false. My doctor told me weightlifting increases testosterone levels. Is that true? And my next thought was possibly they were telling them they weren't going to give them testosterone and you could just do it on your own. Is that true or not? So, nuance. Yes, and. Yes. Strength training properly, and we'll get into how that works, will increase your testosterone levels, especially post-workout. We can measure it in the blood. Testosterone levels go up. Do they stay up though? For some women, yes, it increases it a little bit and it does help. For other women, their baseline is still their baseline. And for other women, as they continue to age, they continue to drop. It doesn't matter if they're strength training or not. But there might be other factors contributing. So we always have to take that with a grain of salt. So what it will do for you, incorporating strength training into your routine, into your life, which I advocate for every single person who has a body, let alone women. Everyone needs to be strength training to some degree, at least twice a week. And you can do a total body workout. You don't even have to do it in a gym like I do here. But boy, does that make it easier because we have all the equipment and you can like measure exactly how much you're adding. We need to add more weight. So we're going to talk about that too. So strength training will, yes, increase your testosterone, at least temporarily after you work out. Again, whether or not that sustains for you or not could vary. It will increase your lean muscle mass, increases resting metabolic rate. So increasing your lean muscle mass increases your lean resting metabolic rate, or increases your basal metabolic rate, your BMR. And that means you can eat more food and maintain your weight. This is huge. There are so few things that will actually change your resting metabolic rate. Things that affect it, that can make it go up or down: chronic stress, lack of sleep, insulin resistance, thyroid function, gut health, and your body composition. The more body fat you have, the less muscle and dense tissue you have, the lower your resting metabolic rate is. That means sitting here not doing a freaking thing. If my body composition wasn't what it was, like my body composition where it's at right now, my resting metabolic rate is around 1,800 calories. I know that because I've done calculations. I've actually measured my body composition, and I've also tracked my food. So it's a 3-part thing, because just because these numbers say this one thing, your body might be doing something else. And there's hormonal aspects of that. And your metabolism changes throughout the month. Ladies who are still cycling, yay. Once we stop cycling and postmenopause, that tends to even out. And we become more like men in that regard, that we're on a 24-hour cycle instead of a 28 whatever-ish day cycle or month cycle. But the nice thing about that is that I can eat more food and still maintain my body composition the way that I want it. I can actually increase my muscle mass, even eating the same amount, just by training harder, making sure I'm eating enough protein and getting enough recovery. Again, we're going to talk more about that. If my body composition was different, exact same weight, I step on the scale, no freaking different. The only difference is when we actually do body composition instead of, for example, if you're 30% body fat versus 40% body fat, okay? Visible abs for women, by the way, little side tip, come around at around 25% downwards of 22% body fat. So if you want to see your abs, it's a body fat composition game, in addition to making sure you're training properly so that you even have any muscles there to show off. And we can't spot reduced fat unless you're using liposuction. That's not a thing. Your body genetically will lose body fat in certain areas before other areas. Like for me, I tend to lose fat up here, waist up, before I start losing fat down below. That's just how my body is. So it lags behind. It's normal. You just work with what you got, right? But if my body fat percentage was higher at the exact same weight that I am right now, instead of 1,800 calories that could maintain my weight, it might be more like 1,500, 1,400, and that might not feel very good. Even though your maintenance calories might be in a certain place, that doesn't mean that you're necessarily satiated with that you feel energized with that you feel good on that. So that's something to take into account. The best way to improve your resting metabolic rate, optimize your hormones, like if you have hypothyroidism, your resting metabolic rate is going to be lower. Getting on thyroid medication, if that's what's necessary for you, or reversing whatever's going on there, will help to increase your resting metabolic rate. Now, we're not talking you're going to be able to eat like 500 calories more a day and maintain your weight. That's not going to happen. It's not a miracle thing like that. It's just going to help you to be able to maintain a weight easier without getting super restrictive. You'll have more energy, less brain fog. Your hair is going to grow back, like those things that were affected by it. If there's other things contributing, say your ferritin was low, which will also affect your thyroid functioning, by the way, ladies. So something very important to look into. But lifting weights, getting stronger, changing your body composition so you have more lean mass, more muscle mass than you do body fat. It's that fluffy stuff that you can see, and also the deep visceral fat that you can't see in the belly that is very bad for you and is linked to higher risk for heart disease, cardiometabolic disease, diabetes, hypertension, even cardiovascular events such as stroke. That's what we were working on. That's why I tout doing, I have a body composition clinic specifically for that, because it's so important to know what your body is doing and where you're actually coming from. You can do measurements, you can do calculations. Any of them are fine. Like the biggest thing is to have a baseline and then know where you're at so that when you go to do some work, you can take measurements again and compare the measurements. But don't compare home measurements to a clinic measurement to a different clinic measurement. It's not going to work. It's different. So keep that in mind. All right. Strength training increases strength, decreases pain, as long as we're doing it right. See a physical therapist if you're having pain. I do. And she's amazing. Dr. Desiree Lyle over at Raise the Bar Physical Therapy. She's fixed me and well, I always fix myself too, but decreases your risk of falls, especially if we're doing like unilateral work, which means like one leg, one arm, one side of the body at a time. And that helps to even out your strength, because we're all, if you're right hand dominant, you're probably stronger on your right side. If you're left hand dominant, you're probably stronger on your left side. That's very normal. If you have a history of an injury, you're probably stronger on the side that doesn't have the injury. Then you're also running the risk of overuse and causing problems on that other side. So it also increases insulin sensitivity. One of the best ways that I have for my patients to improve their insulin sensitivity is to go for walks after meals. What does this do? When we go for walks after meals, you're just walking, you're doing exercise. Muscles do not require insulin to uptake glucose. That's really cool, because when we have insulin resistance, when we test your blood and your insulin levels are high and your fasting glucose is high, even if your A1C looks fine, which is your 3-month average, and your red blood cells, are your red blood cells fine themselves? Because otherwise that measurement could be erroneous. So by using the muscles to uptake that excess glucose instead of having to rely on just your insulin, it really helps that whole system. It takes that burden off, helps with your digestion as well. So it's a really, really great hack to just walk after meals, 5 to 10 minutes. You don't have to go at it for a dedicated walk. Go do the laundry, go do dishes, go do housework, play with the kids, play with the dogs, something like go do something instead of just sitting. We think sitting is digestion. It's not necessarily. A gentle walk is actually much better for our digestion. Okay. We talked about body composition. It will increase your bone density. If you guys are following me like a week or so ago, I was talking about all about osteoporosis. What builds muscle builds bone. Okay. So that's super important. So whenever we're thinking about how do we make sure that my bones are as strong as possible and stay that way all the way up until my final breath when I'm super old and still super mobile and cognizant, hopefully, this is what we wish for all of us, how do I keep them as strong as possible? Well, we have these things called muscles and ligaments and tendons, and they're all connected to our bones. And that is actually, otherwise our bones would just like fall to the ground. We'd just be a bag of bones. So it helps to actually give us that rigidity and help us keep us upright. When we stimulate the muscles through strength training, we're also simultaneously stimulating the bones. This is why weight-bearing activity is so important. Walking is not enough. Not enough. Swimming, great exercise. Not weight-bearing though, okay? Osteoarthritis is so common that a lot of people cannot do high impact. Walking can even hurt. So things like, cycling and water aerobics are great for those people to at least still get that cardiovascular benefit. But we still need them to be strength training however they can, whatever modifications they need in order to continue to build that muscle, keep that muscle, because it gets harder to keep as we age. Part of that is aging. Part of that, especially for women, is the loss of estrogen. Estrogen is an anabolic hormone. That means she builds. She builds bone, she builds muscle and repairs. And as we lose our estrogen, that goes down. So even on HRT, our goal with, and we're calling it MHRT, menopause hormone replacement therapy, our goal isn't necessarily to get you back to your 20-year-old levels, okay? That wouldn't be reasonable and not necessarily the goal, okay? And there are risks of going too high on things like your estrogen. So when I'm watching labs, I'm looking for an estrogen level around 90. That is always taken within the context of the patient's history, their risk factors, and their symptoms. Okay, so that is not like everybody just gets to 90 and then we're good. Some people can't tolerate that. If you have a history of like endometriosis or adenomyosis or something like that, you're more sensitive to estrogen, that probably doesn't feel very good for you. And we actually need to have you on a lower dose. It will still be protective. And that's fine. Okay, so we have to work with everyone's different physiology. Nuanced. You wish this was a short answer. It's not a short answer, is it? Okay. You do not need huge testosterone level changes to get major benefits from strength training. So this is something else that was really interesting. I was looking at these studies. Now, those women who had mild increase in testosterone actually maintained it versus those who really didn't change their levels versus those who continue to decline as they age, still had dramatic benefits. All the benefits that I just listed on the side, all those benefits, they still had those regardless of their hormone levels. This is why it's so important to treat the person and their symptoms and their lifestyle and everything encompassing with labs to help guide us, but not treat just based on numbers. Just because your testosterone level is low, if you're not symptomatic, I'm not going to treat that. I'm going to go after other things you're symptomatic for. Okay? Yes, there's a certain amount of prevention, but testosterone is one of those that we frequently have at least some coming from our adrenals. So your adrenals become your primary source of things like testosterone, estrogen, and even some progesterone after menopause when your ovaries have shut down or after surgical removal of the ovaries or iatrogenic, meaning hospitalization, radiation, chemo, whatever, interfered with blood supply or functioning of the ovaries and they're done. Okay. Even so, it's still important. It still works. And it's the baseline. Testosterone is not going to replace the fact that you still need to go do your strength training. Now, what makes strength training effective? That's where we get to the nitty gritty. So here's where I hear so many women say, I've been training for years and I look the same. That's because the body is very adaptive. So this is why strength training is so great and why cardio really, there's a plateau pretty quickly. And so adding more does not give you any more benefits. Strength training, on the other hand, when done properly, gradually, with proper form. And so if you have no idea how to strength train properly, please get a knowledgeable personal trainer and or physical therapist, especially a physical therapist if you are having any pains anywhere that are chronic. They're the best ones to address those and help you get back to activity in a safe way. But get a knowledgeable person to train with you to show you how to do it properly. When you do it properly, you decrease knee pain, back pain, hip pain, ankle pain, neck pain, shoulder pain, all of the pains. They get better because you're getting stronger. Remember how we talked about how your muscles, ligaments, and tendons are the things that are actually keeping your body upright and attaching to your bones. Otherwise, we'd be bags of bones, right? When we don't have enough strength to keep ourselves upright, to move through life, when your max lift is a gallon of water, that's going to be a problem. You're going to have pain because life hurts you. You're not strong enough. You can get strong though. The body is very adaptive. So going back to this comment of, I've been training for years. I don't look any different. I haven't been able to build any muscle. My body composition won't change. I can't lose fat. Okay. So there's some things that are going on here and we need to take a good hard look. And it's not, and this is coming from my perspective as well of, I'm doing everything I know to do. So this is that whole, and kind of I'm doing everything right and it's not working. Is that true? Or is it more true to say, I'm doing everything I know to do and it's not working? That's probably more true. I've been in that boat. I was in that boat. I got skinny fat. So I lost a bunch of weight. I lost 45 pounds in my late 20s. But then I was skinny fat and I didn't look the way I wanted to look and it wasn't necessarily as healthy as I wanted to be. And then I looked around and was like, okay, so how do I fix this? And external was just the easiest thing for me to go for. So I looked at other people, groups to see what I wanted to look like. And I found bodybuilding. I was like, those people are fit. They look fit. They got muscle definition. They really dial in their diets and their training. Everything is on point. And it's true. So what I discovered was it was the food. It was the macros and it was tracking. And then it was really pushing myself in the gym to actually build that muscle. Lifting the same weight over and over again, you're not going to get any stronger. Lifting tiny little baby weights 20,000 times, you're not going to get any stronger. You'll get more endurance in those little muscles, but it's not going to give that stimulus to the muscle to build. You got to go in the gym or whatever setting, push yourself to that point where it's like, I barely have 2 or 3 more reps in me. So this is called rate of perceived exertion, RPE. We want it to be to like a 7 or 8. You don't need to go to a 9 or 10. You really don't. Although sometimes with supervision, with a physical, personal trainer, physical therapist, you can push yourself a little bit harder with a spotter, just to make sure that you're actually pushing yourself that hard. Because some of us think that we're pushing ourselves hard and we're not. And I've had that experience as well. Ask me how I know. Because I've been with a coach who actually pushed me pretty hard, and I was like, oh, that's what hard is. Okay, I thought I was going hard. No, it was not good. I was not going hard. So pushing yourself hard enough, and that's really important to make sure you're building enough muscle mass. Okay. Progressive overload, we talked about that. Protein. If you've ever heard me talk, I'm sure you've heard me talk about protein. 1 gram per pound of ideal body weight. So for the average 5'5" woman in perimenopause, I'm telling her to get at least 110 to 120, sometimes up to 140, depending on how active they are and what they're trying to do. If they're trying to build more muscle, we actually want to give a little bit more protein. That is what we're aiming for. Protein is absolutely vital in addition to a lot of other things, but protein in particular is absolutely vital to building muscle. It is what's called amino acids are the components of protein. That's also the components of your muscle. If you don't have the materials to build the house, how are you going to build it? It's not going to work. You have to bring the materials in. And we do that through food. You have to eat protein. Every time you sit down, think about, where's my protein? And now double it, because so many women are eating so little protein. Even the athletes that I work with, I am like, girl, no wonder why you're tired. You're training like an animal, and good on you. But yeah, you're exhausted. Yeah, it isn't working. Yeah, everything's in the toilet because you're not eating enough. You're not eating enough protein, especially for an athlete. So it's very, very common. And I don't want you to just go, well, I think I'm eating enough. You have to track it. You've got to get out your stupid little app and actually put the grams in there. Make sure you're tracking it properly, not like, raw chicken to cooked chicken. That's 2 different things. You lose 25%-ish weight when you do that. So you need to make sure you're tracking it properly and being accurate with it. Get a scale. Get your scale out and actually track these things. Okay? That's the only way to tell me that you actually know how much protein you're eating. And then being honest with yourself and being like, oh, I'm not eating enough. Okay. So now what do we do? Well, step 1, you're probably eating the right sources, because if you're here, you probably care. You've been eating healthy, right? I eat healthy. That's not enough. It's not enough just to eat healthy. We need to know how much you're actually eating. So if you eat Greek yogurt, double it. If you eat chicken, double it. You can go to a restaurant, they're probably going to give you 2 little tiny ounces of meat on this giant salad. And the salad's great. We love the salad, but we need to double the protein. At least. Probably more. Okay? So that's vital if you want to grow muscle and improve your testosterone levels that way. Progressive overload. Sleep and recovery. Oh boy. If you're not sleeping and let's say hot flashes are the problem, well, then we can deal with that. We can see if you need some estrogen there. That's the number 1 treatment for it. We also have non-hormonal medications that can help with that. We also have non-pharmacologic things that we can do to help you with your hot flashes. But having a proper sleep routine is important. Getting enough sleep is important. Do you have sleep apnea? Women over 40, your risk goes up, and you may not necessarily be like snoring logs over there, sawing logs, whatever. But if you wake up tired all the time, no matter how much sleep you get, it's worth looking into. It's also worth looking into your thyroid function, your gut health, and your adrenals, all of that. Very important, because that can all affect your sleep. And the loss of progesterone. So progesterone is the first hormone that starts to decline in perimenopause. And guess what she does? She affects our sleep. Your anxiety increases, your sleep gets worse, your PMS symptoms get worse, your cycles get worse, they can get heavier, more bleeding, more clots, because now your estrogen in relation to your progesterone is lower. It's high. is high, sorry. So you have estrogen dominance in relation to your progesterone. Your estrogen is fine, actually, but because your progesterone is so low, now it's unbalanced. So progesterone can definitely be a factor in there. Hot flush can be a factor in there. Sleep apnea can be a factor in there. And then just your routine. What are you doing at night? Are you staying up late at night, like binge watching Netflix when you know you should go to bed? Are you getting yourself up way too freaking early because that's the only time you can possibly get your workout in, and then you're not eating because you got to go straight to the gym, and then you're trying to kill yourself out there, and then you don't eat until about 10 o'clock because you're so busy in the morning? I've seen it all. I've seen it all. Okay. That is going to screw up your circadian rhythm. You have got to protect your sleep. It is important. They call it beauty sleep for a reason. Okay. It is so important. I cannot emphasize it enough. If you're not sleeping, I don't care about anything else that we do. We could throw all the medication, the hormones, and all the training at you in the world. It's not going to make anything better. It's actually, you'll continue to get worse. You'll continue to get worse. So it's absolutely vital that we're sleeping and we're recovering properly. The other thing is trust in your life. If you have zero downtime in your existence and you're still pushing yourself super hard in the gym, that's not sustainable. Your body's not going to respond very well. You will likely end up in that position that a lot of women do as they age, that I'm losing strength, I'm losing muscle, and I'm gaining belly fat. And I'm doing the same thing. I'm not changing my diet. Nothing is different. But I'm still running myself into the ground every single day, and I have zero downtime. Your recovery has to be just important as your training. Just as important. Maybe more important, actually. It really has to be that vital. So if you had a crappy night's sleep, you're skipping the gym. Yeah, you're not going to the gym. Because it's not going to do you any good. It's just going to increase the stress on your body, worsen your cortisol levels, worsen those sugar cravings, worsen your insulin resistance, worsen your anxiety, worsen your brain function. That's not what we're trying to do. You're going to take a day off. You're going to get some extra rest, and you're going to take some more R&R time. And that is the most important thing you can possibly do. You will come back stronger. You will progress more when you actually take the time to listen to your body. You have full permission, and actually I'm telling you that's what you have to do. Underlying factors. So we're looking at, we talked about it, thyroid, insulin, gut, adrenals, vitamin and micronutrient deficiencies. I mentioned it before, low ferritin. It's iron storage. Well, years before you ever are actually iron deficiency anemia diagnosable, you will be tired. You'll be losing your hair, and your testosterone can drop. Your thyroid can start dropping. It's so vital to so many things. Your ovarian function, like everything. We need iron to transport oxygen in our blood through our body. It's super, super important. We also need it for bones. So when we're depleting our iron stores, and ferritin is a very important marker that I don't think is checked enough in primary care. So that's something you can ask for, especially if you're tired and you're noticing the symptoms. That's something to look at. And we want to get your levels upwards of like 60 to 80. So if you're, and I've had patients that are like in the 20s, the teens. I had a patient who was like 7. No wonder why you're exhausted and things are just not going well. Like, we have to fix that. And that, by the way, can take time. It can take time. We have to give you the right type of iron supplementation. It has to be absorbed properly, and there can be absorption problems, and you need to take it at the right time of day. You can't take it with caffeine, with calcium, with a multivitamin. Basically take it away from anything else so that it absorbs properly, or else it's not going to work. And then your body might kind of fight it too, where we have to maybe mess with the dosing, go every other day, because your body is very smart and it's trying to make sure you don't get into iron overload. Even though we're like, no, you're low, we need you to go up. And the body's like, ah. So very, very important. And it can, like I said, it can take, we're talking 8 to 12 weeks for things to start improving. And, for example, like I have low libido, but your ferritin's in the garbage. Guess what? We're focused on your ferritin and your fatigue levels in your hair. The libido is probably not going to come back for another 6 months. It's true. By the way, libido is very complex, so that'll be a different talk because that is a very complex issue. But low ferritin can affect that. You can imagine why. You're tired. Do you want to get down? Not really. I get asked this a lot too. So functional ranges for testosterone. We're going to talk about another marker that you maybe don't even know anything about, and that's very important that we make sure that we're checking with your testosterone levels. So for perimenopause, total testosterone levels, 20 to 50 nanograms per deciliter. We can start to see symptoms between 25 to 30 for some women. So again, we look at the labs, but we also look at the person in front of us to see what they're doing. What are your symptoms, right? If she is 20, but she's not symptomatic, I'm not going to treat her for that. We're going to treat her for other things that she's symptomatic for. We don't over-medicate. We don't give hormones just to give hormones, okay? It's not the practice I run. So if that's what you're looking for, that's not for me. There's other practices out there that do that. That's not me. Free T3. So there's total T3 and there's free T3. So free T3 is what's actually available right now in the body, in the blood, to be used by your cells that can be bound up. So much smaller levels. So for perimenopause, we're looking at 1.5 to 4.0 picograms per milliliter, PG per ml. And then for menopause, free T, testosterone. I almost said T3. Did I say T3? Free testosterone. Sorry. My abbreviations here. Menopause, free testosterone, 1.0 to 3.5. Okay, so a lot smaller. So what affects that? Why is total and free testosterone so different? Well, there's this little binding protein called SHBG, sex hormone binding globulin. And what this little guy is, think of it like the bus. It's the little bus and it's running around and it's picking up excess things and likes to pick up hormones. Really likes to pick up testosterone. If we have too many buses, and they're just like trying to shove the buses full, then we don't have enough walking on the street available to be used. They're stuck on the bus, okay? If we don't have enough buses, then we have too much wandering the streets, wreaking havoc like testosterone likes to do. So we need just the right amount. It's Goldilocks, right? So SHBG optimal levels are 50 to 90 nanomole per liter, okay? Let's talk about why SHBG can be high, because I see this a lot. I'm also talking about why it can be low, because I've seen that a lot too. So high SHBG, meaning more of the little buses binding up your testosterone. So you have lower free lower free testosterone. And even if your total testosterone levels are completely fine, within range, if your total testosterone levels are low, you're going to be symptomatic, okay? And that could be because your SHBG is high. So if it's above 100, reasons why is things like your estrogen might be really low. Isn't that interesting? Some people's bodies do that. If the estrogen gets too low, it will increase SHBG. Also, if you're on estrogen replacement or especially birth control. So birth control pills, which is really funny. Little side note, those people who are okay with birth control pills but aren't okay with MHRT, menopause hormone replacement therapy, birth control pills and birth control methods like that, and the Depo shot and things like that, way higher in synthetic estrogen and progesterone than any menopause hormone replacement that we ever use. So much higher. Super high doses, because the point is to shut down the whole system so you do not ovulate. That is not the point of MHRT. MHRT, the point is to get you back to normal physiologic levels. So it's different, okay? But that's one of the mechanisms by which birth control pills work, is it increases SHBG, binds up those estrogen, progesterone, and unfortunately your testosterone, which is why we see some of those side effects when you're on birth control pills, like low libido, low muscle mass, weight gain, and just not really feeling like yourself. So increase in thyroid activity. So hyperthyroidism or overcorrection of low thyroid. So too much thyroid hormone can cause increased SHBG. Liver disease, low calories, you're not eating enough. Too much cardio, over exercising, not enough protein, low insulin, low carb states can cause an increase in SHBG and therefore drop your other hormones because they're all bound up in the bus. Significant weight loss. Hi, GLP-1 people out there who are having that side effect, right? If we're losing a lot of weight, especially very quickly, that can be a problem for our hormones. Natural aging can increase our SHBG. Genetics plays a role. Can't really do much about that. Certain medications can do this, and chronic stress and cortisol dysregulation. Page 4. Low SHBG. So we're talking SHBG less than 40. Insulin resistance, very common. I see this a lot. Inflammation, also see this a lot, and especially like chronic inflammation. So we're looking at things like your HSCRP. We're looking at your white blood cells. Not as common, we look at ESR, just because it's so nondescript, and as far as in functional medicine and chronic care, it's not really, it's more of an acute type of an issue that we used to use a lot, still use a lot in more infectious disease type situations, and also in some orthopedics as well. High androgen status, so your testosterone levels are too high, then your body's going to protect you, and actually doesn't protect you. High androgens will actually drop your SHBG, which will just then make things much worse. You're going to feel more androgenic. And then a metabolic dysfunction, diabetes and things of that nature. Metabolic syndrome, which is high blood pressure, increased belly girth, and insulin resistance. So all those things together can drop your SHBG. So did that answer the question? So, doctor said weightlifting will increase your testosterone levels. Sort of. Yes, it does. Again, transient, right after strength training, like what I just did, my testosterone levels are elevated right now. So treatment options that we have, though, DHEA is one that I've used with success with some of my patients. So DHEA is a precursor hormone. Comes from your adrenal glands. And so especially those patients who show adrenal dysregulation, chronic fatigue. They call it, some people call it adrenal fatigue, which is a misnomer. That's not really true. That's not actually what's going on there, but that's one of the, terms that's out there. But basically your cortisol pattern is kind of like flattened. So it's supposed to be like it comes up in the morning and then we have a nice little peak, and then towards the evening, it gradually decreases. That's what it should look like. For most people, right? For every people, for human beings that are on the 24-hour clock here. It has to do with your light exposure, it has to do with your sleep, it has to do with your food. There's so many things that can affect it. Your mindset. I'm going to talk about that. Your mindset and where your mind goes. And it's so true, if you believe it will work, it will work. That's why placebo is such a strong thing. There's like 20% effect from placebo alone. And that's why we have to measure things against placebo, because our brains are so powerful. If we believe that something is going to help us, then it will. If you believe that nothing is going to help you, then it won't. There it is. That's all you need. No, we have medicine for a reason. But so thinking about things that you can do to improve your testosterone levels as you age, strength training absolutely needs to be the cornerstone of it. Proper diet absolutely needs to be the corner of it. Sleep and recovery, absolutely pivotal. And then getting your hormone levels checked, talking with a provider who's going to listen to you and work with you. And knowing that it can be a road, by the way. This can be a journey. This is not necessarily something we can turn around in 3 months. How long has this been going on? Like, how long in your life? It's like someone who wants to lose a bunch of weight really quickly. First of all, is that healthy? Probably not. And second of all, how long did it take you to put that weight on? And you think you're just going to turn around and get rid of it within like 3 to 6 months? And the closer you get towards your goal, by the way, the more your body is going to fight you, and the more we have to like employ some other tactics, reverse diet breaks, more strength training, more recovery, things like that. And it just gets slower, and that's normal because your body's like, we're good. What are you doing? Why are we doing this? So using things like DHEA, I talked about your cortisol patterns. The DHEA comes from the adrenals. So if you're chronically stressed, giving you DHEA, if that is appropriate for you, again, working with a provider, you shouldn't just go out there and take anything just because you heard it on some social media, something. Always talk with your doctor about it. And if they don't want to talk to you about it, or they don't seem to know what they're talking about, find someone who does. We're out there. If you go to the Menopause Society website, you can look for a menopause doctor near you. We tend to have gone through more training. Some of us are board certified. Some of us aren't on that website. I'm one of the ones here locally that is board certified. I'm one of two, at least on that website that I see here locally, that is board certified in menopause. So it just means I went the extra mile. I did the extra training, and I had to sit down for a board exam and from a brain answer a bunch of questions, which was actually pretty difficult. So those exams are no joke. So, and then after that, I get that certification, and I have to maintain that with continuing education and re-upping that every few years. So, so you can find a provider there that's willing to talk to you. DHEA is an option, and or we can use actual testosterone. Testosterone is not FDA approved for use in women. Not yet. They just don't have the evidence to support that yet. So there's no formulation that's made for women. We have to use the men's version on women, which means we have very tiny little doses that we use for women. I prefer topical. Oh, quick note on pellets. I don't prefer them. I do not prefer them. The reason being that we're sticking something inside of you that's going to release a certain amount of hormones, and we have no idea if that's the right dose for you. And once it's in there, we can't take it out. We have to wait 3 months for it to wear off. I've seen plenty of women come to me who have had this done, and they are way high on their testosterone. And who knows what else they're putting in these things. And those are not FDA approved either, by the way. So if you're getting your estrogen, progesterone from a pellet, that's kind of a waste of your money and your time, because progesterone and estrogen for hormone replacement, for menopause hormone replacement, are FDA approved. You can get it from a pharmacy. Your insurance will cover it. There is no need, unless for some reason we've tried all of the different options from the pharmacy, from the FDA approved, blah, 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 and you're having bad reactions to it or something. We run through our options. And we're like, okay, this person's not tolerating that allergy that's in whatever. Then that would be the appropriate time to go, okay, maybe we need to look into compounding and give her a cream, make sure we remove everything we can that could possibly irritate her, and go in that direction. Okay. But there's really no need to put it in a pellet and throw it in your body like that. And same thing with testosterone. Granted, yes, testosterone, it doesn't matter where it comes from, whether it's pellet, compounded, or gel, or injection, or sublingual, troche. None of them are FDA approved for women. So they're all going to be off-label. None of them are covered by insurance that I found. So they're all going to be out of pocket. But for those women who's appropriate for, and not every woman should be on testosterone. I've seen commercials about that too. They're like, every woman who's going through menopause should be on all the hormones, including testosterone. That's not necessarily true. Again, we're treating the person in front of us, and she may not want to be on testosterone, and that is fine, okay? But some of them would really benefit from it. And not every case of low libido is only from testosterone. Your estrogen actually has a lot to do with your libido too. Your diet, your lifestyle, your recovery, your dynamics with yourself, your body, your partner. Read the book Come As You Are by Dr. Emily Nagroski. It's really, really good. And she goes deep into all the different aspects of attraction, libido, orgasms, all of it. Like, she will talk to you about it. And it's really eye-opening. It really is. It's very complex. It gave me a greater understanding of what we're dealing with here. And then also an understanding that just because I give you one thing, like we give you estrogen vaginally, and then we give you testosterone, and then all this other stuff, that might not fix it. Like, we can fix some things with that, but there might be other things going on there. And maybe sometimes we just need to uncover those things. We start with where we are. We start with the biggest complaints. We start with the biggest issues, and then we go from there, right? So yes, we can use testosterone on women. It is perfectly safe. We're not doing super high doses. We're trying to get her back to a physiologic range where she feels good again. So it is appropriate. It is safe. It's just the FDA and the powers that be and the money and all that crap and the bias in the medical research, and they don't like using women, especially perimenopausal women, especially cycling women, women who are technically still of childbearing age. If you're still cycling, you could get pregnant, you could get pregnant, and they don't want to do studies on us. Like, that was actually banned for a while. It's only recently that they unbanned that with huge restrictions. So it's in the name of protecting us, but is it really protecting us? It's a huge mess, guys. So in the interim, we still can use testosterone, but we need to be aware that it's not a fix-all. Like anything else, it's not a fix-all. You still need to be doing the work. You still got to be tracking your protein, tracking your calories, tracking your fiber, tracking everything, okay? Until you understand where it's at. You don't have to track forever, but ignorance is not an excuse, okay? It's like, oh, I overdrew my bank account. Well, I didn't know. I didn't have money in there. So can you just like reverse that? No. It's your job to be paying attention to these things. So if you don't know how to do that, then learn how to do it. Get your little app, MyFitnessPal, Chronometer, whatever you use. My patients have access to our app and Practice Better, where they can track their food in there. And it was very similar to MyFitnessPal or any of those other trackers, except that they can put in their mood and how they feel before and after they eat, which I think is awesome. And then all the other things too. You can track a lot more in that app there. So it's a really great tool, and it gives us a lot of feedback. It gives your provider a lot of feedback. It gives you a lot of feedback so that we know exactly what's going on, and then we know where to go. How do we know how to get from A to B if we don't even know where we are right now? We have to figure that out. Look at the map. This map is what you're actually doing right now. Where do we want to go? Okay, now let's figure that out. Okay. All right. As I said, you don't have to sweat, and here I am sweating, but it is lunchtime for me. I hope you guys are having a wonderful Wednesday. It is midday through the week, so here we go. Is it Wednesday? No, it's Thursday. I don't even know what day it is. Okay. All right, I hope you guys are doing well. Send me your questions. Let me know what you want to know about, and I'll catch you on the next one. Bye.